This is Owen Fender delivering a policy presentation for State Senator Greg Meyer. Representative Meyer, in December of 2018, Caitlin Moss and her husband left their home in the middle of the night to begin a 100-mile journey through the winding, snow-covered roads of western North Carolina. They were not responding to a family emergency or avoiding natural disaster, but simply Caitlin Moss was in labor. She had to give birth, but the only place to do so safely was 107 miles away in Asheville, North Carolina. You see, Caitlin Moss lives in what is known as a maternity care desert, meaning her home county lacks a hospital with an obstetric center or birth center where she could receive vital prenatal or postpartum health care. And as you can see from the map, Miss Moss is not alone. Sadly, the March of Dimes nonprofit organization has found that 21 out of North Carolina's 100 counties qualify as maternity care deserts. But that is why I'm excited to talk to you today. I believe by the end of this presentation, with the legislation I am suggesting you propose, you will realize that you are in the best position possible to bring healthcare back to North Carolina mothers, while at the same time gaining votes in your own district. I bring this issue to you not because it is a mere inconvenience to travel so far for the birth of your own child, but because there are serious health implications involved. The March of Dimes also found that lacking access to prenatal care can increase your chances of pregnancy-related death in both mothers and children. Sadly, we see that that tends to be the case in North Carolina. This is research conducted by the CDC, reported on by the News and Observer, and it found that the maternal mortality rate in North Carolina was 68 deaths, measured out of 100,000 births, which is far above the national average of only 45 deaths. Another statistic found by the Carolina Public Press is that due to inaccessible prenatal health care, 1 in 12 North Carolina babies will receive either late prenatal care, meaning they do not receive vital health care until the third trimester, or no health care at all. Now, you may be asking yourself why. Why is it that so many North Carolina counties are unable to provide this health care for their mothers? Sadly, the answer is simple: money. The UNC Center for Health Services found that 12 hospitals have either shut down or no longer offer in-person services in rural counties in North Carolina. The NC Health News publication found that an additional 14 rural counties have lost their birth center since 2014 alone. Now, the reason for this, according to the American Hospital Association, is that people in rural counties tend to rely on government-assisted healthcare for their essential healthcare needs, meaning in the rural counties of North Carolina, people are more likely to rely on either Medicare or Medicaid. And until the recent Medicaid expansion, there simply hasn't been enough business for these hospitals to stay open. Thankfully, however, Medicaid has recently expanded in December of 2018, in December of last year, excuse me. And according to WRAL News, 600,000 North Carolinians are now more eligible for Medicaid. And I guarantee you among that number will be mothers seeking maternal health care. So my plan is for you to introduce legislation into the North Carolina Senate that would establish state-operated obstetric centers throughout North Carolina in the current maternal care deserts. Now, of course, the first hurdle with any type of legislation like this is how will we pay for such clinics? Well, the answer for us is the federal government. As part of the federal government's plan to reduce maternal mortality in America, they have established what is known as the Rural Maternal Obstetrics Management Strategies Program, or RMOMS for short. Now, RMOMS has already provided funding to 9 states who have established programs to reduce maternal mortality and bring maternal health care closer to rural communities. And that is exactly what our program aims to do. All we need to do is reach out and take the money that is there and available for us to use. However, introducing this legislation in the Senate, you are likely to come against resistance. A common resistance you may face in North Carolina is that there will be a general uneasiness about having state-operated healthcare facilities. But to those people, I would suggest that our clinics will just be joining the ranks of specialty facilities that are already operated by the state. According to the North Carolina Department of Health and Human Services, The state already operates neurological centers, drug abuse and alcohol treatment centers, psychiatric centers, childhood development centers, and much more. The reason these centers exist is because they are filling specialty necessary gaps in the private healthcare sector in North Carolina. And that is exactly what our program intends to do. Fulfill a gap that is existing in the private healthcare in North Carolina. Now, this program not only benefits thousands of mothers in North Carolina, but it can benefit you yourself, uh, potentially. I know that you represent North Carolina Senate District 23, and although you won your last election, you lost the vote in Caswell County. It just happens that Caswell County is a rural maternal care desert. And if this plan were to work, it would benefit your constituents of Caswell County and likely get you necessary votes in a county that you have been struggling in previously. But before we end, I want you to remember who this legislation is really for. It is for all the Caitlin Mosses in North Carolina who have had to travel great distances for necessary health care. It is for all the women in North Carolina who can, for the first time, afford maternal health care. But because it is so far out of reach, they feel that it is inaccessible to them. For all of those mothers that would be affected, and all of the unborn children that will be also affected, I suggest you propose this legislation to the North Carolina Senate. Thank you.